for coming and seeing us today. Michelle Glover is our Zaya activewear rep, and all of the activewear that you see here is from Zaya. We absolutely love them, so thank you for being here. And Got Beauty, Tammy Taylor and her crew are incredible. They have their main flagship location, which is just down the street, but they were kind enough to have a little micro space for us. We love their stylists, we love their beauty experts, so thank you for being here. And a special thanks to Galderma. Tamara Wilder is our rep, and she makes all of this Sculptra yumminess happen. So if you have any specific questions related to Dysport or Restylane family or Sculptra, and I'm not around, you can look for this gorgeous face, and she may have some of the answers you're looking for. So let's just get right into it. So Sculptra is one of my favorites for a reason. We have kind of 3 buckets or 3 options that we can pick from when we're thinking about injectables and how we can use that for anti-aging. So the first bucket being just topically treating the skin. So things like microneedling, chemical peels, IPL, clear lift. Those are all great ways to treat the superficial part of the skin. Then we get into muscles. Muscles are where our neuromodulators or our toxins do the very best work. They're gonna help to kind of smooth out some of those wrinkles that we get as we age, really improve the texture of our skin, as well as the muscle and overall aging of our face. Then we get into dermal filler. Dermal filler is great. It's comprised of something called hyaluronic acid. Hyaluronic acid is made naturally in our body. We find it in other products that are great for our skin, and it keeps the hydration in our skin, but also HA has the ability to come in a gel-like form, which we can use for dermal filler. Dermal filler is great for different areas of the face that may call for it. The nasolabial fold, underneath the eyes, the temples, the lips, of course. Jawline and other areas of the body can benefit from a little bit of hyaluronic acid injection. And then we come to the third category. The third category is my favorite, and the third category is collagen stimulators. So we all know that we have collagen and elastin in our face, and when we're young and we're in our teens and a little bit more youthful, right, when we were first getting into our 20s, we loved the look of our skin and the suppleness of our skin because it had plenty of collagen and elastin, right? Lots of foundation, lots of support, lots of fullness. But as we age, right, we get into our 20s, 30s, at age 45, we have globally lost 25% of the collagen and elastin in our face. So my lovely model just happens to be 45, and he is kind of our model for today. So 25% we may not think is a big number, or maybe you do think is a big number, but at 45, if we've lost 25% of that, our foundation is probably getting a little bit of a change. Now there are other factors that obviously go into why we start to look different as we age, right? Our bone density being one of them starts to thin. We lose that density that we once had that kept everything nice, high, and tight. We also start to lose some of that muscle density. Our muscles get a little bit thinner. Our fat pads that keep the suppleness to our face, those start to thin out as well. Hormones, genetics, sun exposure, free radicals, lifestyle, a lot of things can also contribute to an aging face. So collagen stimulation and collagen synthesis is really the key to making sure that the foundation stays exactly how we want it, or we build on it to get it back to where it was when we were youthful. Because that's where we get the nice return and that youthful look without maybe, say, looking too overly done. I think all of us have identified aesthetically when someone has had maybe a little bit more filler than they should have. Maybe they've just recently had a facelift or surgery. So there are a lot of ways that we aesthetically kind of assess our social surroundings in our community just through a visual look. So Sculptra is not going to be one that's identifiable. The nice thing about Sculptra is because it's just a solution, kind of think of it like fertilizer for our face. After you're injected, you're gonna have a period where it's gonna look very full, very voluminous, but then that's gonna be absorbed by the body, and the body's gonna take that and it's gonna figure out how to rebuild and restructure all of that collagen, which is yummy and delicious and all of us want. So what is Sculptra made up of? So we know that it promotes and will regenerate collagen. It's made up of something called PLLA, which we don't really need to know, but the PLLA stands for poly-L-lactic acid. So what's neat about that is it comes from and derived from sugar cane. So if we think about the structure of sugar cane, it almost looks like a little scaffolding when we see it under the microscope. So if we think about it, injected into the face, it's going to create that nice little scaffolding so that all those new cells, new collagen, new fibroblasts can all be attracted to that new area to support and kind of fill in those gaps. Now, Sculptra is not going to be just a one and done. Unfortunately, we're in our 40s, we're in our 50s, whatever age decade number you're in. We've had some time to lose collagen and elastin. And unfortunately, it's not a fast food treatment where we can just drive in, get what we need, and drive out and be done. Sculptra is something that we will want to visit in sessions. So how many sessions am I going to need, or how many can I expect I'll need in my lifetime? It's totally dependent on you. Remember, there are lots of other factors in aging that can contribute to the reasons why myself in my 30s may look different than someone else in their 30s. So everyone is going to be a little different, but I would say a good way to kind of track how many Sculptra vials you'll need is just starting with 3. That's a great way to kind of get your baseline, to see how you like the results, and to see how much your body's going to reproduce. Another good kind of rule of thumb is, okay, well, I know I'm gonna need 3, but maybe I'm in my 60s or 70s. How many vials can I expect? Honestly, like I said, it's something that you and I are going to talk about. We're going to figure out what's best for you. But Sculptra usually says, depending on the number of decade you're in, is about how many vials you'll need in order to get you to that nice refreshed baseline, right? So if we're in our 40s, we may need 4 vials. If we're in our 50s, we may need 5 vials, and so on and so forth. Again, there are other reasons that we would change that number, or that you may need less or more. Now, can Sculptra be used anywhere else besides just the aging face? Yes, we use Sculptra in a lot of different areas. One being the neck and the décolleté. As we age, of course, our neck and our décolleté start to age with us. Some women are really bothered and plagued by the look of that tech neck, maybe some texture changes, as well as on the décolleté. So Sculptra is great. We can also use and implement that as well. We can use it on the back of the hands. I hear a common complaint that females especially feel like they start to get that bony kind of prominence, or that kind of veiny look to the back of their hands. We can use Sculptra to help rebuild the collagen in the back of the hands as well. The Kardashians have made the very famous Sculptra booty. So a lot of areas of the body can be enhanced, and also cellulite camouflage with a little bit of Sculptra as well. So let's just dive into it. So I have topically numbed my model here. My model is also my partner. I'll try not to beat you up too much. So we've used a little bit of topical numbing, and I'm just going to go through and talk to you a little bit about how we're going to assess his face and how I kind of determine what areas will be the best for him to get an overall kind of anti-aging treatment without looking overly done or overly filled. So men are going to be a little bit different than our women population, especially when we're looking at just overall assessment. Men have a lot more thickness to their dermis, or their skin, as well as they have a lot more muscle and bone density and bone prominence. So as we're looking at our face, you can kind of do this at home too. I always start with the temples. The temples are usually an area that we don't think about, but as they start to lose their volume, they start to create almost like a concavity to the look and appearance of overall face. So Matt is very fit. He exercises every day. He does a lot of running. Running can be very jarring on the face, as well as if you're exercising all the time, you're going to get a lot of wear and tear on the muscles in our face, and that's just kind of the pros and cons with working out. So you can see his temples have started to lose a little bit of their volume bilaterally. So for him, we're going to target the temples just to bring them back out so that you can no longer see kind of this little occipital suture line. It's going to give him just that nice youthful restoration without changing a whole lot of his features. Now, the back of the face is a huge area where we start to see change, this little crescent shape. So for men and women, the temple starts to lose volume, as well as this little tiny shelf. So this shelf is your zygomatic bone. And as we start to age, we can start to get that little hourglass appearance where some prominence is noticed, like the bony prominence back here. Then we have more fullness towards the bottom of the face. A lot of people start to complain about the jowls or areas that they're not loving on the lower third of the face as they age. Now, Matt doesn't necessarily have any change to the lower third, the very lower third, but if he did, we would start to see heaviness right through here in the jowls. So another area where Matt's had some change is right through this little malar pad and submalar pad. This is a big area for every single person, and an area that we could all benefit, because It holds a lot of the structure for our mid-face. So restoring this little malar pad or this little mid-shelf will really help to revolumize his face without giving him something that he didn't already have, right? This little area existed once upon a time, but it's thinned out as he's aged, as he's exercised, weight loss, weight gain. That will all change these little structures and these little pads and areas of volume. So what Sculptra will do is just naturally revolumize these little areas, which will help to keep that lower third of the face nice and high and tight. So Sculptra can be injected in many different ways. It can be done using just a regular traditional needle. I like to use something called a cannula. So this is a cannula. A cannula is a very flexible piece of plastic, and it has a blunt end, so it doesn't have a tip like a needle. And the really nice thing about this is that I can get this into areas that I may need, but it's not going to poke or get into or enter that area because of the blunt end. It's almost like I would have to really use something sharp in order for me to penetrate. So it's nice and safe to use, especially with Sculptra. We want to put the product exactly where we want it, not somewhere we don't.
I have a question.
Yes.
If you're allergic to lidocaine, what can you use?
Great question. So he's actually resistant to lidocaine. So we use something called bupivacaine for him today. Bupivacaine or Nescaine. We have different options. For his topical, I used benzocaine, prilocaine, and tetracaine. So all of the other canes in the family, just not the lidocaine specifically. Yeah, that's a great question.
Because I start outline and I just know that have some allergy to the lidocaine and they get anaphylaxis reaction.
Right. And I'm just going to kind of talk through the areas that we're going to treat. So we talked about treating his temples. Go ahead and open your mouth for me really, really right. Perfect. So when he opens his mouth, I'm able to kind of see exactly that little pocket that we're going to be filling in the temple. And opening the mouth will just make it a little bit more comfortable for him.
That was still the lidocaine?
So this is the Sculptra.
Oh!
So this is the Sculptra. So I only make serial injections into the temples, and then I'll be using the cannula for these others. So you can see the temple just immediately pops right up.
The matrix you feel my brain.
The IQ just...
The IQ is just...
I can see your brain. It really does help keep that eye nice and open too. Yeah, because it does. It feels like the eye kind of sinks in. That is amazing.
A little bit of temporal volume just kind of restores the overall frame.
And it's stuff that you don't really notice
And it's
until...
so natural too. It's not like you would look at him and go, oh my gosh, he just had his stuff.
No.
Just very nice and subtle.
I just see the difference, you know.
Just the difference, but
Yeah.
not anything that would give away.
And I wouldn't have noticed it if you hadn't done it, but when you bring it up,
Nice little, yeah. That nice little
Very
change
nice.
that just really breathes.
So now will that...
So I can get into all the areas that I want. Right there.
Oh, and then you put the sculpture through that.
Exactly.
But the cannula had the blunt edge, right?
So this is the cannula. So
So this has that nice blunt edge,
Oh, that's the canyon. Okay,
so it's not going to get anywhere. This is
Okay.
my pilot hole.
Okay.
He's in charge of making that little entryway for me. And then once my entryway has been made, I can use this just like just go ahead and reach exactly where I want.
Nope.
That's great. So,
And we're
and
just going to do a couple little.
so you just kind of go here, there, and you can feel it yourself. You can, not him, but
I can
you
feel it
that
as I go.
moving.
Just I'm kind of making sure I'm checking the plane that I'm in.
Is it just like right below the skin, or is it under?
It's pretty deep. So the way that you can kind of tell, sorry. So as I'm lifting, that's about how deep I am.
Yeah, it's dramatic, actually. You can see the difference right away. I mean, then that'll go down, but eventually it'll all go back up. And first she did hollow out. So she did one side. And now she just did that cheek. That's the
Thank you. Take care. I'm gonna go back and just do a couple serial injections just right where I want it. Sorry.
Oh, sugar.
Are you doing okay, sir?
I'm doing great.
Okay. Because nobody's asking you.
Yeah, how are you
You're
doing?
not screaming, right? Do you have a stress ball?
No stress ball.
Yeah. Alright, so we're almost done with one half. You can kind of start to see the difference between the temple, this malar cheek, how it starts to just lift up the nasal
it'll be beautiful. More sharp because it's just kind of picked up, moved everything tighter.
Looks great
I'll
on
go
her.
like this.
Looks good.
Wow. You have to like pose.